and welcome to Health Life at Seniors Today. Today is World Liver Day, which is on April 19th. To those of you who are not connected with us live, World Liver Day is observed on April 19th, and it was only appropriate that we have our Health Life session focusing on liver. And the topic we have is liver care for seniors. And we are delighted to have Dr. Alisha Chaubal from the Nanavati Max Hospital. She is Principal Consultant Hepatology at the Nanavati Max Institute of Liver, Intestine and Pancreas Sciences. Before I invite her, I'm going to just introduce her. So, the Nanavati Max Hospital, which is in Mumbai, has an Institute of Gastroenterology, Hepatology and Therapeutic Endoscopy, liver disease unit, liver transplant unit, an acute liver failure unit as part of the hospital, which is there in Mumbai. She has in the past also worked with the Glen Eagles Global Hospital, and she was with the Fortis Hospital in Mumbai, as well as the Jupiter Hospital in Thane. She is also Assistant Professor Gastroenterology at the Lokmanya Tilak Medical College in Mumbai. She has done her MBBS from the Grant Medical College and JJ Hospital in Mumbai. She is an MD in medicine, again from the same hospitals, and a DM in gastroenterology from the LTMMC, which is the Lokmanya Tilak Medical College in Mumbai. She is a member of the Indian National Association for Study of Liver Diseases and the American Association for Study of Liver Diseases. She has been receiving several awards, and she has a special interest in acute on chronic liver failure, hepatocellular cancer, viral hepatitis, non-alcoholic fatty liver disease, transplant medicine, and like. She has submitted several papers, and we are indeed delighted to have Dr. Alisha Chaubal here. Thank you and welcome to Health Live at Seniors Today.
Thank you, sir. Thank you for that kind introduction. So today on World Health Day, Hepatitis Day. I'm very happy to see such a large crowd who have gathered to hear this lecture. I hope it is more of an interactive session than a lecture. So I shall not take up too much of your time.
There are
Should
people
we start
who are
the session?
assembled. There are people who are assembled here, Doctor, as well as people who are connected on YouTube who are watching this.
Right.
And
Correct.
as always, we'll have your presentation running. And after the presentation, to all of you here, please take full advantage of it. The recording of this session will be there on the website from Monday evening onwards, along with the takeaways. So don't worry about taking notes, etc. Now you can always watch our recording on Monday evening on the Seniors Today website. And please post your questions after you heard a doctor speak. Do remember, sessions like these are always advisory in nature. And if you need specific advice, you must visit a doctor and take, get a clinical examination and take advice. Of course, all the doctors who we have on our Health Live sessions can also be teleconsulted, and you can approach them at the hospitals where they consult. Over to you, doctor.
So today I'll be talking on a topic which has become very common, which is fatty liver disease.
Right.
So I'll be discussing about fatty liver and a few do's and don'ts in fatty liver. I hope it is a very lucid presentation. So basically, this is what your healthy liver looks like. It is shiny and brown. And as fat starts depositing on the liver, as you can see on the right side, it becomes yellow and swollen up. This is what we call a fatty liver. So if there's more than 5% fat accumulation in the liver, it is a fatty liver. As most of us must be knowing that India has become the diabetic capital of the world. So also we are inching towards becoming the fatty liver capital of the world. As you can see, we are in the red zone for fatty liver. That means more than 30% of the population is having a fatty liver. In fact, a study was done in the south of India, and they found that nearly 60 to 70% of the individuals have a fatty liver. A lot of us have gotten a sonography done, and it has been found that we have a fatty liver. You can see on sonography that sometimes they report it to be grade 1, grade 2, or grade 3. So, should we be really worried if we have a fatty liver? So, the answer is yes and no, because as you can see in this slide, These are the things which can happen to you if you have a fatty liver. So first, it's a healthy liver, and fat starts accumulating on it, which we call as steatosis. Once the fat accumulates on the liver, the next stage is NASH, that is steatohepatitis, where the fat starts injuring the liver. So in this, your liver enzymes can go up, and your blood test can start showing slightly elevated SGOT and SGPT. Then this injured liver eventually starts becoming stiff and leads to liver cirrhosis. And the last stage is of liver cancer. So, as you can see, people who are obese, 30% of the general population will have a fatty liver. 30% of them will go ahead and develop injury to the liver, and around 10% of them will go and develop a liver cirrhosis. So, if you take it prevalence wise, it is quite a large number. So, all of us know the normal causes of fatty liver. That is, we assume that a person who is fat will have a fatty liver. So, that is a correct assumption. But apart from the normal causes of fatty liver, there are also other causes like alcohol, some medical drug intake, like painkillers or medicines that you take for arthritis. They can also lead to a fatty liver. Surprisingly, if you starve, then also you end up having a fatty liver. So there is a concept called as metabolic syndrome. So as I said, who are the people who should worry if they have a fatty liver? So if anybody who has diabetes or hypertension, that is having blood pressure of more than 130 by 85, who is obese, who has cholesterol problems, who has thyroid problems, or a family history of liver cirrhosis and liver cancer, they should definitely test for fatty liver. What age to test is negotiable when you get diagnosed with the problem or when you are 35 years of age. An annual checkup is advisable. This is the concept of visceral obesity. Not everybody who is fat will have a fatty liver, or who will have heart problems or kidney problems. So what is important is the distribution of the body fat. So what do you feel, which is a better body shape to have? Is an apple better or a pear is better? So apple means the fat around your navel is more, and pear means the fat around your hips is more. So out of the two, the pear is the better kind of obesity to have. It is normally seen in females. So if you have more fat around your tummy than around your hips, that is the apple sort of distribution, then it correlates with more fat around your organs. So which are the soft measurements of visceral fat? So there is something which you can calculate on your phone, that is called as the body mass index. There are normal indices which are different for the European population and for the Asian population, which takes in account your weight and the height. The waist circumference, when taken around your navel, can tell whether there is more visceral fat. So the cutoff is 80 centimeters in female and 90 centimeters in male. Then there are more accurate measures like the bioimpedance analysis and DEXA scan, which are both available at our hospital. So these machines can tell you exactly how much fat is there in your body, how much is the muscle mass in your body, the bone mass in your body, and also the degree of visceral fat. So how should I test for fatty liver? As I said, normally all of us end up doing blood tests once a year, but very few of us get an abdominal sonography. So, in fatty liver, the thing to note is that even if the blood tests are normal, you can still have fat on the liver, and the liver could still be turning cirrhotic or fibrotic. So, a basic sonography of the abdomen is recommended once a year, along with your other metabolic tests, which is like your hemogram, the liver functions, that is LFT, creatinine, diabetes profile, that is HbA1c, which tells your sugar control over 3 months, lipid profile, which is for your cholesterol, TSH is for thyroid, and uric acid. Now, as I said, your blood test can more or less be normal if you just have a fatty liver, but still your underlying liver could be turning stiff or cirrhotic. So, how do I know that it is turning stiff? So, a test for fibrosis is must in patients who have fatty liver. So, there are two tests available. One is a fibroscan, which is kind of like a sonography of the liver, and one is an MR elastography. which can tell you if your liver is turning stiff. So this is how a fibroscan is done. It is not an invasive test. It is not a biopsy. So basically, it is a sonography of the liver, which tells you exactly how much fat is there on the liver, as you can see by this CAP score, which is around 234 in this person, and the stiffness, which is 3.4 kPa. So if it is more than 9, the stiffness, then it suggests that the patient is having advanced fibrosis, and if it is more than 12, then it suggests that the patient has liver cirrhosis. So MR elastography is what we prefer at our center. It is a more accurate test of fibrosis than fibroscan because it is not operator dependent and probe dependent. And also, what we have seen recently is that fatty liver has become the number one cause for liver cancers. So, this MR elastography even helps you to pick up small cancers which would otherwise not have been seen. So if you have fat on the liver, there is a high likelihood that you have fat around your other organs also. So you should also do an annual screening for the heart, for the kidney, for the eyes, and for the bones. So for the heart, you do tests like the ECG, which is an electric cardiogram, 2D echo, stress testing, and for the kidney, you do certain tests to see whether your other organs have also gotten affected, especially important when you have diabetes. So, symptoms of fatty liver. So, this is the most important point that I would like to make in this lecture, that there are no symptoms of fatty liver. So, you develop symptoms only when you have advanced liver disease, that is, you developed liver cirrhosis. So these are the symptoms of liver cirrhosis. So these are the symptoms of liver cirrhosis. One is ascites, that is this fluid developing in your tummy. So your tummy gets distended. You could have blood in the vomiting or in the stools. If you do an endoscopy, this is the picture that we get. You have large swollen blood vessels in the food pipe, which could be bleeding. There is another symptom which is called as encephalopathy. Means liver cirrhosis is not only limited to liver symptoms, it can also present with other symptoms. That is, you can have increased forgetfulness, or there is a change in the sleep wake cycle. Like the person could sleep throughout the day, does not get sleep at night, has a lot of mood changes. So these are soft symptoms of encephalopathy. So you'll end up going to a neurologist, but you actually might be having liver cirrhosis. If a patient with liver cirrhosis develops weight loss or loss of appetite, then there is a high suspicion that the patient has developed cancer. Weight loss is a very bad sign in most things. So, if you are having any disease and you are having weight loss, then you should never ignore it. Weight loss always means that there is underlying disease, especially when it is more than 5 to 10% of your body weight over a period of 3 months. Then you should seek help immediately, unless, of course, you've intentionally lost the weight. Okay, so coming to the treatment for fatty liver, like a lot of people have asked, "Ki, okay, I have a fatty liver, but what should I do about it? Can I just go on living with it, or do I need to do something about it?" So the only treatment for fatty liver is weight loss. So if you lose around 7 to 10% of your body weight, then you can even reverse fibrosis, not cirrhosis, but early stages of fibrosis are reversible. So this is the chart. Like not everybody who has a fatty liver needs to be started on medications. So people who are having overlying liver inflammation, that is the SGOT, SGPT have gone up, or on the fibrosis scan, we have come to know that the liver is becoming stiff. Then we start them on medical therapy for fatty liver. Along with treatment for fatty liver, it is also very important to continue treatment for the heart, for the diabetes, and cholesterol issues. So these are the three cornerstones of managing fatty liver. One is weight loss, making special changes to your diet, and following a regular exercise regime. So what is the diet which you should follow if you have a fatty liver? So there are a lot of dietary fads going on in the market. So do they help? It is yes and no. So they are drastic measures which can make you lose weight very fast, like intermittent fasting or a keto diet, but they're not very easy to follow in the long term. So the ideal diet that one should follow is something which we call as a Mediterranean diet. So this is what your plate should look like. So initially it was thought that if I have to lose weight, I should go on a fruit diet. So contradictory to what is believed, fruits are actually not very good for your health. So you should not consume more than 1 to 2 fruits per day. There is something called as a glycemic index, means the amount of sugar which is absorbed from the foods that you eat. So food stuff which is having a low glycemic index should generally be preferred in your diet, and you can easily look it up online which are the foods with a low glycemic index versus which have a high glycemic index. So fruits like banana or chiku should be avoided. You should prefer fruits like apples or papayas or berries. Berries are the best for you. But all the same, the portion should not be very large. It should be around 1 to 2 cups, not more than that. Vegetables should have a high portion, not the starchy vegetables like potatoes or sweet potatoes, but the other ones. Grains should be preferably whole grains. You should avoid processed grains like maida and rice. Wheat also, to a certain extent, is not tolerated by quite a few people. So, preferring millets like jowar or bajra is ideal. Proteins need to be good, especially if you're a vegetarian. Then the sources of protein are limited. So, it is paneer, soya bean, or pulses, which you should include in your diet. This should all come with a healthy glass of water to wash down your food. So, this is the recommended activity that should be followed. Around half an hour of brisk walking daily for at least 5 days a week should be done. Reducing sedentary behavior means when we are talking or doing other activities, we should try to walk around. So, in general, our activity levels increase. The health bands also are helpful because they tell you exactly the number of steps that you have covered. Resistance exercises, strength training, that is picking up weights. So this is also useful to build up your muscle mass. So there is a concept of obese sarcopenia. So only the people who are underweight are not the ones who are malnourished. Even people who are fatty, they tend to have a low muscle mass. So in these patients, it is very important that they develop their muscle mass by doing some amount of strength training. Uh, this is the next question which is often asked. I have a fatty liver. Can I take alcohol? So, if you have fibrosis or cirrhosis, you should definitely not take alcohol. Otherwise, the recommended amount is 10 grams per day in males and 7.5 grams per day in females, which comes to half a glass of wine. So these are the plethora of medical therapies which are available for fatty liver. Vitamin E was one of the first approved medicines for fatty liver. It is more effective in bringing down inflammation than actually cutting down the fat on the liver, as it is an antioxidant. Next is our very own Indian medicine, which is saroglitazar, which is very good in bringing down uh, fatty liver, especially in patients who have diabetes or cholesterol issues. GLP-1 agonists or weight loss medicines, these are the new kids on the block, which everybody is raving about. So, should we be using it? Should we not be using it? Is a big debate. There are tablet preparations available and once a week injections which are available. Now they have gotten available even in India. Earlier, they used to be exported from other countries. Since March, we have both GLP-1 and GLP-GIP agonists available, that is Ozempic and Mounjaro. So they do cause weight loss. There is no doubt about it. So they are extremely effective. So they do lose, patients do end up losing around 20 to 30% of their body weight by just using these GLP-1 agonists. So what is the concern is that uh, around 20 to 30% people stop using it because they have intolerable GI side effects, that is gastric side effects. They develop abdominal pain, nausea, constipation. So a dose titration helps, means you start with a small dose and then gradually increase. One worry is the risk of gallstone formation, especially if you lose weight very rapidly, then it could lead to gallstone formation. There is also a theoretical risk of pancreatic and other cancers. So, if you have cancers, then you should be, or a history of cancer, then you should be extremely careful and preferably avoid the medication. If there is no response to medical therapy, then bariatric surgery is the next thing which can be used. In bariatric surgery, they either cut a portion of your stomach so that your stomach becomes small in size. This is something called as a sleeve gastrectomy, or they just bypass a portion of your bowel so that the food doesn't get absorbed, which is called as a Roux-en-Y gastric bypass. So these are also other options which are available. So that is the end of my talk. So basically, screening for fatty liver, that is investigating at least once a year for fatty liver in people who have metabolic syndrome, that is diabetes, cholesterol, thyroid issues. Blood tests and sonography is for diagnosis. Fibrosis scan is a must, that is either a fibroscan or MR elastography. And diet and lifestyle interventions are the cornerstones of managing fatty liver. Thank you.
Thank you very much, Dr. Chaubal, for this presentation around fatty liver. A question that I have for you upfront is fatty liver the primary problem that people have, or is there anything else also that seniors should be worried about?
So fatty liver normally develops in people who have other issues, like I said, who have diabetes or cholesterol problems or thyroid problems. But there is a concept of lean NASH. Even thin people can develop a fatty liver, especially those who have a high intake of carbohydrates. They can have a fatty liver. Uh, so yes, it is normally associated with other health issues also.
Right. There's a question from Sunita Verma who asks, do males have more cases of fatty liver, or is it the same with women as well?
So
I think we've lost Dr. 1 second.
from all these issues,
Sorry,
from
doctor, can you just
cardiac issues.
repeat? Can you just repeat the answer, because I think we lost you a little bit.
Yeah, I said females are protected from cardiac disease and
Oh gosh.
from fatty liver estrogen content, but post menopause the risk is similar to males. In fact, the risk goes up slightly. But till menopause, yes, the males are more affected than females and by all these lifestyle diseases.
Right. We have a question from Mukta Garg, and who says, my husband suffered of liver cirrhosis and cancer. So, do other members in the family also have to take care?
Yes, definitely. So the kids have to be screened for fatty liver and tested once a year. There are genetic tests also available, but they don't definitely correlate with you having or not having. So anybody who has had a history of liver cirrhosis or liver cancer in the family should definitely screen once a year for fatty liver.
Right. That's a question which also Shilpi Bishwas order asked. There's a question from Shamla Ravi. Is there any age limit to take hepatitis A and B vaccines?
Sorry, no, there is no age limit to take the vaccines. So, in fact, it should be taken by most adults as the vaccination has been implemented only in the last 10 to 20 years. And people who have had blood transfusions before the year 1990 should definitely screen once for hepatitis B and hepatitis C because prior to 1990, the blood used to not get checked for hepatitis B and C.
Right. We have a question from Shamala Ravi again. Suppose we missed the vaccine. Is it okay to take it later?
Yeah, so 3 doses of the vaccine need to be taken. at 0, 1, and 6 months, or 0, 1, and 2 months, depending on the urgency. But you can check your antibody titer levels. If they are more than 100, you can just take a booster. If they are less, then you need to repeat the entire vaccination course again. So normally, two vaccination doses also give protection in around 80 to 90% of the people.
Right. There's a question from Shobha. Her question is, does itching in the whole body, is it the repercussion of a fatty liver?
Not fatty liver, but it could imply that the liver is it is turning into advanced liver disease. There is underlying liver fibrosis, cirrhosis, or sometimes even a liver cancer. Itching is normally a sign of advanced liver disease.
Right. My This is from Kalpana Gupta. My both arms are black. Is this due to fatty liver?
No. So, as I said, it again depends on the stage of liver disease. If you have advanced liver disease, that is liver cirrhosis, then it is possible to have this thinning of skin, darkening of the face, itching, all these other changes which are there,
Right.
bulging of the breasts in male, or uh, losing hair over the body. These are all signs of advanced liver disease or cirrhosis, not of early fatty liver. No.
Right. Thank you. We have a question from Mr. Anil Singh, who's asked, what is the ideal quality of water to be taken, especially for seniors who want to keep the liver healthy?
So, liver as such is not kept healthy by water intake, but a good amount of water intake is recommended definitely for your kidneys so that you don't get dehydrated, which would be somewhere around 2 to 2.5 liters, depending on the humidity and the climate in your area,
Right.
but at least that much.
Doctor, we have a question from Bomi who asked, Doctor, does eating non-vegetarian food on a regular basis cause a fatty liver, and is a
Yes,
person who cirrhosis hereditary?
yes. So, the first question, there is a higher chance not of fatty liver, but obviously of cholesterol issues, because quite a few of the non-vegetarian food, especially red meat, that is your mutton, or prawns, that is shellfish, prawns, crabs, they are very rich in cholesterol. So they should be avoided in general. The safer choices of non-vegetarian food is probably egg white or white fish, which you can consume around 2 to 3 times per week, but should be preferably avoided on a daily basis.
Right. There are a host of people who are compulsive non-vegetarians. From the liver point of view, what is your advice to them?
So I think slow and steady, like it has definitely been shown that red meat is bad for you, alcohol is bad for you. So you have to start making these health changes at an early stage rather than a late stage when you have already developed liver cirrhosis, liver cancer, or diabetes and issues with diabetes, heart disease. So that is not the stage when you start taking corrective measures. You have to take it from earlier on and do things which are healthy for you. So you should visit a dietitian and definitely try to cut down your non-veg intake over a period of time. It can't happen in a day's time. So maybe a few months.
Right. We have a question from Mr. Anil Singh again, who says, if a person is taking blood thinning medicine for a very long time, will it affect the liver? If yes, then what precautions can the person take?
No, it does not affect the liver. So blood thinning medicines are mainly taken by people who have heart disease or some sort of blockages in the blood vessels. So they do not harm the liver in any way, and they should in fact be taken and are somewhat beneficial also for liver disease. In fact,
We have a question from Mr. K. Suvanayan, who is 72. He's given all his blood work reports, but the basic thing is, in his recent scan for full abdomen, says grade 1 fatty changes in liver. Is this a concern, and should one go for medication?
So grade 1 fatty liver, as I said, if you have other risk factors also, or you have abnormal, at least you should do your blood test and you should do a fibroscan or an MR elastography to know the exact status of the liver, whether your liver is becoming stiff, how much fat is there on the liver. And then depending on that, you will be advised either dietary changes alone or dietary changes with some form of medication if your liver is turning stiff.
Right. One last question, doctor. We have Mr. Suresh Ghate, who is 72 again. He says, I'm regularly suffering from constipation. I have to take Ayurvedic purgatives quite often. 3 years back, undergone valve replacement surgery. And he's taking blood thinning medicine, avoids non-veg, oily fried foods he doesn't have, but still faces problem of constipation. I know this is a liver-related sense, but still, since
So
you're
yeah, so we actually have lot of patients who come with gastric problems and attribute it to the liver because the liver is thought to be a digestive organ also. But yeah, as you rightly said, constipation is not directly linked to the liver. So you can, constipation is a different lecture altogether, where you can increase your fiber intake, increase your amount of water and exercise, and see if natural things help. Otherwise, there are laxatives or medications to help you with constipation.
uh, Doctor, thank you very much. We've answered quite a few questions, but one final message from you, since it is World Liver Day and we have seniors here, and you mentioned a statistic of 30% of India has fatty liver. Is there
So it
any?
is at least 30%. It is actually 60 to 70% in adults. And the shocking thing is it is 30% in children. The incidence of fatty liver, it was conducted in children between the age groups of 10 to 15, school going children, and they found that 30% of them had a fatty liver and they were also overweight and obese. So it is all because of, I think, mainly the processed food intake, which should be cut down, the sugar intake. So carbohydrates are the, uh, initially it was thought that it is only fat which is the culprit, but carbohydrates have also been found to be bad if you have a fatty liver, or carbs eventually turn into fat. So what is carbohydrates is basically your sugars, either your fruit sugar or the sweet things that you take, the artificial sweeteners that you take, or rice. So all these things are rich in carbs, and one should cut down their intake. So the takeaway message is basically that fatty liver has become a common problem, and in your annual health checkup, which should ideally be taken after the age of 35 or 40, once a year, everybody should get their basic blood work done. With the blood work, you should also do an abdominal sonography. If you have a fatty liver, you should not ignore it, even if it is grade 1. You should at least do your blood test and you should do a liver fibrosis scan to see whether your liver is becoming stiff. And diet is the best way to get rid of the fatty liver.
And people like doctors like yourself, you all have a very stressful day, etc. How do you kind of manage your food style and works with your work style? How do people manage? I know we have an audience of seniors and they may not have as busy a day as yourself, but their families do have. And what you tell me, and what you have told us and what others have told us in the past.
So I think we need to start changing our food preferences. We should do away with the cheese and the butters and opt for healthier stuff like salads. Replace your grains. We are very used to a rice-based diet, so replace that with millets like bajra, and also replace your cooking methods. Like avoid the deep frying, lot of use of oil, and replace it with grilling or something like that, air frying. I know it is a thing that you should practice what you preach. It is not always very easy, but I think in the long term it is good for you. So as I said, Rome was not built in a day, so things are not going to change overnight. But I think it has to be a eventual effort, and you can achieve the goals in 6 months to a year's time.
Thank you very
So,
much, Dr. Alisha
and
Chaubal,
also,
for being here.
sorry.
sorry. I'm saying thank you very much for your session today. I know it is World Liver Day, and doctors like yourself are busy with various programs that are being organized today on this occasion. To all of you here, the recording of this session will be there on the website on Monday evening, so you can take a look at that. And we will be back once again with our next session of Health Live at Seniors Today next Saturday at 5 p.m. To you, Dr. Chaubal, thank you very much, and to the people at the Nanavati Max Hospital for facilitating this. A big thank you too. Thank you very much.
Yeah. Thank you so much, and have a good evening. Bye.
Subscribe now and press the bell icon. Never miss an update.